Hello everyone, welcome to Scalp Acupuncture featuring Paralysis, Stroke, presented by Lamp Acu Wellness Foundation Inc. Paralysis refers to complete or partial loss of muscle strength and voluntary movement for one or more muscles. Paralysis can be localized, generalized, or it may follow a certain pattern. Paralysis is most often caused by damage to the nervous system, especially the brain and spinal cord. Such damage may be due to stroke, trauma with nerve injury, poliomyelitis, amyotrophic lateral sclerosis, botulism, spinal bifida, and multiple sclerosis. Paralysis due to stroke, multiple sclerosis, and traumatic injury of the brain or spinal cord are the most commonly seen problems in our practice. Most paralysis caused by nervous system damage are constant in nature. There are forms of periodic paralysis, including sleep paralysis, which are caused by other factors. Paralysis can be accompanied by a loss of feeling in the affected area if there is sensory nerve damage as well. The chain of nerve cells that runs from the brain through the spinal cord out to the muscles is called the motor pathway. Normal muscle function requires intact connections all along this motor pathway. Damage at any level often interrupts the brain's ability to control muscle movements, resulting in paralysis. Paralysis almost always causes a change in muscle tone. Paralyzed muscles may be flaccid, flabby, and without appreciable tone, or may be spastic, tight, and with abnormally high tone that increases when the muscle is moved. Paralysis may affect an individual muscle, but it usually affects an entire body region. The distribution of weakness is an important clue to locate the level of nerve damage that caused the paralysis. The types of paralysis are classified by region. Monoplegia is impairment in the motor function of only one limb. Diplegia affects the same body region on both sides of the body, both arms, for example. Hemiplegia affects one side of the body. Paraplegia is impairment in motor function of both legs and the trunk. Quadriplegia, also known as tetraplegia, is paralysis with partial or total loss of use of all limbs and the torso. Paralysis is also divided into 4 types in neurological practice, namely upper motor neuron paralysis, lower motor neuron paralysis, paralysis due to neuromuscular transmission diseases, and the paralysis caused by muscular diseases. To test the strength of each muscle group and record it in a systematic fashion is important before and after scalp acupuncture treatment for paralyzed patients. It can help localize a lesion to a particular cortical region and spinal cord level, evaluate scalp acupuncture treatment, and give the patient encouragement when there is subtle improvement that the patient might not notice. When evaluating a patient with paralysis, the practitioner should follow a systematic approach that includes inspection of muscle, palpation and percussion of muscle, manual muscle strength testing, and assessment of motor function. It is useful to pair the testing of each muscle group immediately with the testing of its contralateral counterpart to enhance detection of any asymmetries and record detailed information of any changes. Muscle strength is often rated at 6 levels on a scale of 0 out of 5 to to 5 out of 5. The level of 0 out of 5 shows no muscular contraction, which means complete paralysis. The level of 1 out of 5 shows some muscular contraction but no limb or body movement. The level of 2 out of 5 shows limb movement is possible but not against gravity, which means the limb can only move in its horizontal plane. The level of 3 out of 5 shows limb movement is possible against gravity, but not against resistance by the examiner. The level of 4 out of 5 shows limb movement is possible against some resistance by the examiner, but it is still weak compared to a normal limb. And the level of 5 out of 5 shows normal muscular strength, which means complete recovery from paralysis. Scalp acupuncture is frequently used in rehabilitation of paralysis due to stroke, multiple sclerosis, spinal cord injury, and traumatic brain injury. It has been proven effective in treating any type of paralysis, sometimes taking only 1 to 2 treatments for an amazing amount of recovery. We have seen hundreds of paralyzed patients with remarkable results in the US, China, and Europe, allowing many patients to leave their wheelchairs, walkers, crutches, and canes behind. Stroke is an acute neurological disease in which the blood supply to the brain is interrupted, causing brain cells to die or be seriously damaged, thus impairing brain functions. Stroke is classified into 2 major categories: ischemic and hemorrhagic. In an ischemic stroke, a blood vessel becomes occluded and the blood supply to part of the brain is blocked. Ischemic stroke is divided into thrombotic stroke, embolic stroke, systemic hypoperfusion, and venous thrombosis. A hemorrhagic stroke occurs when a blood vessel in the brain ruptures and bleeds. The bleeding vessel can no longer carry the blood to its target tissue and interrupts the brain's blood supply. Hemorrhagic stroke is commonly divided into 2 types: intracerebral and subarachnoid. The symptoms of stroke depend on the type of stroke and the area of the brain affected. These include weakness, paralysis or abnormal sensations in limbs or face, aphasia, apraxia, altered vision, problems with hearing, taste, or smell, vertigo, disequilibrium, altered coordination, difficulty swallowing, and mental and emotional changes. Some stroke patients may have loss of consciousness, headache, and vomiting at the onset. If the symptoms disappear within several minutes, up to a maximum of 24 hours, the diagnosis is transient ischemic attack, or TIA, which is a mini or brief stroke. Those symptoms are warning signs, and a large proportion of patients with TIA may develop full strokes in the future. Stroke is the 3rd leading cause of death in the United States after heart attack and cancer, and it is a leading cause of adult disability. It is necessary for stroke patients to receive emergency treatment with Western medicine, and it is important to identify a stroke as early as possible, because patients who are treated earlier are more likely to survive and become less disabled. Stroke survivors usually have some degree of sequelae of symptoms, depending primarily on the location in the brain involved and the amount of brain tissue damaged. Disability affects about 75% of stroke survivors, and it can affect patients physically, mentally, emotionally, or a combination of all three. Because each side of the brain controls the opposite side of the body, a stroke affecting one side of the brain results in neurological symptoms on the other side of the body. For example, if stroke occurs in the motor area of the right side of the brain, the left side of the body may show weakness or paralysis. Although there is no cure for stroke, most stroke patients now have a good chance for survival and recovery. When stroke patients pass the acute stage, they should start rehabilitation as soon as possible. Stroke rehabilitation therapy helps patients return to normal life as much as possible by regaining and relearning skills of everyday living, such as speaking or walking. Treatment may include acupuncture, physical therapy, occupational therapy, speech and language therapy, and massage. In Chinese medicine, the stroke itself is thought to involve several inter-promoting disease mechanisms, possibly including qi stagnation, heat, phlegm, blood stasis, and of course, wind. Hence, the common name for stroke in Chinese medicine is wind stroke. A patient had a stroke from cerebral thrombosis only 11 months before. His right arm and hand had been paralyzed for 11 years. His tongue was a little purple with a normal coating, and his pulses were bilaterally fine and wiry. TCM pattern, qi stagnation, and blood stasis in the channels and network vessels. Area selection. Primary area, upper 1/5 and middle 2/5 of the motor area. Secondary area, the upper 1/5 and middle 2/5 of the sensory area. For treating motor dysfunction, place the needles and rotate them at least 200 revolutions per minute for 1 to 3 minutes every 10 minutes for a total of 30 to 60 minutes. The worse the symptoms or longer the duration of disease, the longer the duration of each treatment should be. Unless the paralysis is due to the removal of damaged tissue by brain surgery, a paralyzed extremity is generally treated by choosing the opposite side of the motor area on the scalp. The upper 1/5 region is used to treat contralateral dysfunctional movement of the lower extremity, trunk, spinal cord, and neck. The doctor should twirl the needle as vigorously as the patient can tolerate and have the patient move the affected limb actively and passively. It is helpful to have the patient exercise the affected limbs with or without assistance as indicated between needle stimulations. During treatment, some patients may have sensations of heat, cold, tingling, numbness, heaviness, distension, or the sensation of water or electricity moving along their affected limbs. Those patients usually respond and show improvement quickly. However, those who don't have such sensations could still have immediate effects. Initially, treatment should be 2 to 3 times a week until major improvements are achieved. Then once weekly, then every 2 weeks, and then spaced out as indicated by the patient's condition. A therapeutic course consists of 10 treatments. Scalp acupuncture has been found to have very good effects on the sequelae of stroke, including hemiplegia, aphasia, and abnormal sensations in the limbs. Thanks to advanced stroke research and brain imaging technology, doctors are continuing to gain new understanding of how the brain can adapt after stroke in order to regain its ability to function. New research suggests that normal brain cells are highly adaptable. They can undergo changes not only in function and shape, but also can take over the functions of nearby damaged cells. Because of these abilities, scalp acupuncture is geared towards stimulating and restoring affected brain tissue or retraining unaffected brain tissue to compensate for the lost functions of damaged brain tissue. In our patient's case, the hemiplegia was caused by cerebral thrombosis, which has the best prognosis for recovery from stroke compared to cerebral embolism and cerebral hemorrhage. It is necessary to point out, however, how unusual it is that a patient gets only one scalp acupuncture treatment and recovers completely. In our normal practice, it often takes from several weeks to several months for stroke patients to improve and recover. Also, the time frame for patients with stroke to be treated by scalp acupuncture is crucial. The earlier the treatment, the better the prognosis. When treating stroke from thrombosis or embolism, scalp acupuncture treatment should begin as soon as feasible. When treating a hemorrhagic stroke, however, scalp acupuncture should not be performed until the patient's condition is stable, probably 1 month after a stroke. As we discovered with our patient, a patient with any duration of stroke disabilities can be treated, but treatment within a year brings about the greatest response in our experience. The longer the duration of the impairment, the more gradual will be the improvement. With long-term conditions, expectations need to be realistic, although occasionally a patient will surprise practitioners. It is hardest to achieve improvement for a patient with paralysis for a long time, especially if there is also muscular atrophy and rigid, inflexible joints. There are several different acupuncture techniques to treat paralysis. Although scalp acupuncture has the best and fastest response, other techniques are necessary for a fuller recovery. According to the individual's condition, regular body acupuncture, electrical acupuncture, and moxibustion, as well as physical therapy and massage, can combine with scalp acupuncture to speed up the time of recovery. Regular acupuncture treatment has been found to have positive therapeutic effects on the recovery of movement in the hands, fingers, feet, and toes. In treating unilateral paralysis of the limbs, traditionally, more points from Yang-Ming channels are selected because Yang corresponds to movement and agility, and foot Yang-Ming stomach channel controls muscle functions. Commonly used points are LI4, triple burner 5, LI11, LI14, and LI15 for upper limb paralysis, and bladder 60, bladder 57, gallbladder 34, stomach 36, and gallbladder 30 for lower limb paralysis. Although more Yang-Ming points are used for paralysis, points from Yin channels, especially Tai Yin and Chui Yin channels, should not be ignored. Yin corresponds to nourishing muscles and tendons, and points from Yin channels have positive results for pronounced stiffness and contraction of the limbs. Commonly used points are lung 5 and pericardium 6 for upper limbs. And spleen 6, spleen 9, spleen 10, and liver 8 for lower limbs. Hand or foot paralysis is relatively difficult to recover and often requires a longer process, especially for a contracted hand and foot. To relax contractures of the hand, thread a 2-inch needle from LI4 under the palm toward pericardium 8 and SI3. Stimulate this needle with vigorous thrusting, lifting, and twirling. Thread another needle deeply from triple burner 5 toward pericardium 6 and stimulate in a similar fashion. To relax the upper arm and shoulder, thread a needle from LI15 to LI14 and stimulate vigorously. To relax contractures of the foot and ankle, thread a 2-inch needle from stomach 41 toward gallbladder 40 and bladder 62. Thread a second needle from stomach 41 toward liver 4 and kidney 6. Thread a third needle from liver 3 through the foot to kidney 1 on the sole of the foot. Stimulate all needles with vigorous thrusting, lifting, and twirling. For additional effect, thread a long needle from gallbladder 34 through to spleen 9 and from bladder 60 through to kidney 3. Electrical stimulation is very helpful if the practitioner has difficulty performing needle rotation of more than 200 times per minute. It is suggested that only 1 to 2 pairs of the scalp needles be stimulated at any one session, or the brain can become too confused to respond. For electrical stimulation in body acupuncture, fewer than 4 needles should be stimulated in each limb. Best results are achieved by applying low frequency, for example, 3 Hz, with high intensity, for instance, when visible muscle contraction is observed. Moxibustion can enhance the therapeutic results of scalp acupuncture, especially for older or weaker patients. There are considerable clinical studies and experimental research showing the excellent results obtained from scalp acupuncture on paralysis due to stroke. Jiao Xunfa, the founder of scalp acupuncture, collected and analyzed 20,923 cases of paralysis caused by stroke from 1970 to 1992. After treatment on the motor area of the scalp, 7,637 cases were cured, or 36.5%. 7,117 cases showed marked improvement, 34%, and 5,196 cases showed some improvement, 24.8%, yielding a total effective rate of 95.13%. Cha Hua-Yu reported on 1,800 cases of paralysis due to stroke treated on the motor area by scalp acupuncture in 1992. The results were as follows. 462 cases were fully recovered, that's 25.67%. 950 cases markedly improved, 52.78%. 292 cases somewhat improved, 16.22%, and 96 cases failure, 5.33%, yielding a total effective rate of 94.67%. Findings in these two studies are very similar. Liu Chun Hao and colleagues reported on the treatment of 60 cases of paralysis due to stroke using scalp acupuncture in 2010. The duration of the paralysis was from 1 day to 14 days. The patients were randomly divided into a body acupuncture group and a scalp acupuncture group, 30 in each group. The body acupuncture group was treated with needling from GV20 penetrating to Taiyang, and the scalp acupuncture group was treated at the motor area. Treatments were given once a day, and 14 treatments comprised a course. The neurological deficit scores, or the NDS, and the therapeutic effects were compared before and after treatment, and the contents of plasma endothelins, or ET, and calcitonin gene-related peptide, CGRP, were tested on the 2nd and 14th days respectively after initial treatment. The results showed that the effective rate was 86.7%, 26 out of 30, in the body acupuncture group, and 80%, 24 out of 30, in the scalp acupuncture group. The NDS of both groups were statistically decreased, less than 0.01. The ET level was also decreased, and the CGRP level was effectively increased in both groups. Thank you very much for your attention, and hope to see you in our next videos.